Good afternoon, everybody. So today we're gonna talk about how to develop a seismic compliance plan. And before I go into the details of it, I'd like to just point out our just recent webinars that we covered this year. So there are a lot of good information about seismic compliance plan and details. One particular one that I want to point out is the one that we conducted back in March 4th. So this webinar goes really into the step-by-step application process and some details around that, the regulation details, and if the facility is seeking delays beyond 2030 deadline, it also touches on that one. Today's meeting or today's webinar is more about the examples and some do's and don'ts. The other webinars, MPC compliance, water rationing plan, and SPC compliance truly helps with the seismic compliance scope. So we highly also recommend to watch that if you haven't done so. We put links so that you can straight go to the webinar itself. So these are pre-recorded handouts, so everything is there. And if you are one of the smaller rural hospitals, we definitely recommend you to look at the February 20 webinar, because there's a state grant that may help you with the seismic compliance. So with that, we kind of split the today's presentation into really three things. One, just a brief background. The second one is the application itself. And the third and most important part where Haley will cover is examples. So we're going to show you a bunch of cases where it might help you. On every webinar, we try to give an overall summary in the beginning. So here it is for this one. Two points. One is seismic compliance plan is required for all hospitals. So the deadline to submit is at the end of this year. So all general acute care hospitals, the code requires to submit one. And the second takeaway is we have an example spreadsheet on our website, and this link is live, so you can basically go to the handout and click on this link. It downloads this spreadsheet that has a lot of examples in it. So we definitely recommend you to download and take a look at it and how it applies to your facility. A little background, seismic compliance plan. This is nothing new. More than 25 years ago, all the rules and regulations were set, and since then the requirement has not changed. The only thing that changed over the years is how the submittal is done. So back in 2001, which was the first due date, paper submittal. Then we switched to PDF over the years. Now 2025, we rolled this automated submittal. The information required remained the same. So it's just the way of submitting, way of tracking has been improved over the years. So during that improvement, the project application record type changed, meaning that if you did an application in the past, probably your project number were starting with SCR. So we are now out of that record type. Now it's gonna start with CP, compliance plan. So the record types that when you apply, when you're gonna see, it's gonna start with CP dash your facility number. So it's a pretty straightforward numbering. So the application, I just want to point out that there's a lot of misconceptions about seismic compliance plans, because when people see the word plan, they think about drawings. So this is really not about the drawing or calculations or evaluation. This is simply an outline of how each building in the facility will achieve seismic compliance by the completion date. So it's a super high level information. So if you know all the answers to what to do for each building, then it's a pretty straightforward application. So in this application, we split it into two things. One, two tables really. One is the compliance method. So basically, this is outlining method of compliance for each building. And the second table is building milestones. So this goes into critical and regular milestones for each building, and I'll go into critical and regular in the next few slides. But this is basically about the details of the building, and this is about campus-wide, building by building, what is the overall method. And there are in the application, there are like few other minor questions. Contact information is just usual application information. Okay, one thing that is also has been a requirement is in our California Administrative Code, it says that if there's a change to the compliance plan, then it needs to be resubmitted. And this requirement has been around for a long time, and we have not received many updates from many facilities. So that a deadline was put to get all the updated information. So if you have submitted an application in the past, 2002, 2005, or whenever, it needs to be updated, and the due date is at the end of this year. There's further information which I won't get into in this presentation. We have a policy intent notice, PIN 80, that goes into all kinds of detailed information, regulation, some question answers, things. So it's just I put a link here. Please take a look at it. It outlines the rules, and also PIN 80 it explains the delay beyond 2030 cases. So again, this is a really good resource when you are preparing your seismic compliance plan. So the application process, we have a user guide that basically explains step by step. So at each window, when you hit next, what you're gonna see. So this user guide really goes into that. This user guide doesn't tell you, what you need to say. It's just how the application is step by step. So this link is also live. So if you click on that one, it should take you to this guide. In one of the steps of compliance plan application, it asks the ownership. So this is something new in terms of the ownership type information. So it has a drop down, and the drop down basically spells out different types of ownerships for the seismic compliance purposes. So if we step back and basically talk about what's the intent of this question. So when a hospital can be owned and operated by the same entity, or it might be owned by an entity but operated by a different entity. So this basically asks who's actually financially obligated for these upgrades. So is it the operating entity or is it the owner? So this basically goes into that question. And to answer that question, it basically asks a couple information, and it's pretty straightforward. So in the managing organization, we'd like you to put the organization or licensee name, so that we basically correspond with the right people. Okay, so the two tables that I mentioned earlier, this is the first one, the compliance method table, which goes building by building. So once you start the application, all the buildings in your facility will be pre-populated for you. So you don't need to enter, how many buildings you have, or the building names, or the SPC MPC rating. Those all will be there once you start the application. The columns that needs your input is, first one is compliance type, and it's a drop-down menu, so you have a chance to look at all these options and see which one that your plan is, and a few sentence narrative, and if you have any project numbers, so that goes here. And then if we have any comments, you're gonna see our comments right next to each line. The next table goes into building by building. So for each building, again, these are pre-populated. It goes into now your milestone type. So you have choices, and we hope that all of these choices will cover every scenario. So choose the one that you have in terms of what is coming up, and Haley will show you a bunch of examples regarding different cases. But this table really is your building milestones. So how are you gonna get to compliance, taking what steps at what time? This table answers that question. Now, as things develop, the status will change. So you're gonna go from not started to in progress, and then to completion. And as things get updated, this status will change. The date may change. So there's an amendment process of when things start getting maybe delayed, or a scope change is coming up. So those things, you have a chance to revise it when things are changing. Similar to the previous table, the HCAI reviewer will put some comments here, and so that when we comment on it, you will be able to see that at the right place, right next to it. So it's pretty straightforward. So as you see, every building with 10 milestones, it can add up quite quickly. So if you have 20 buildings, that is 200 milestones. So the big question will become, okay, is the facility on track to compliance? Sometimes it may start getting a little difficult to see that because each building may have a different progress. So this is where critical versus regular milestones come into picture. So for example, your building 1 has these 10 milestones, and if you look at each of these and then say, okay, I'm gonna choose 10 critical milestones that will basically identify some major items in each building, and then for the whole facility, these will be the critical ones that we will also track. So if you start hitting all the critical milestones and achieving those, it kind of in general shows that the facility is on track. What we advise is choose these critical milestones for significant tasks, not like, you know, a little canopy upgrade. So maybe a tower SPC upgrade coupled with a, you know, nursing wing, some MPC upgrades. So something significant so that it shows the big progress. We developed some frequently asked questions, and that is on our website. So we tried to cover some general ones. We also put additional resources, guides, previous handouts, sample templates, etc., etc. So always, please keep an eye on frequently asked questions, because when we hear the same question twice, then we try to put that question in our FAQs. All right, so in terms of next steps, when we receive the compliance plans, we take a look at, okay, are there any major mistakes? So in the application filling out process, sometimes things are like copied over and over again. So we try to catch those mistakes, and we also try to see if the proposed dates are somewhat reasonable. So for example, if you put a 10-story new tower and it's gonna get started and finished in two months, obviously that's not a reasonable timing. So we will, if we see something that is not reasonable, we'll pick up the phone and talk to the facilities directly and hear them out. But there's some reasonableness review in the compliance plans. So we will put everything in writing as well, and the facility will always have an opportunity to respond. So if a delay is asked, and for the facilities who are eligible, the compliance plan and the delay request should go hand in hand. So what we are trying to say here is, let's say 2-year delay is requested. We'd like to know why that 2-year delay is necessary. So a lot of those answers are actually in compliance plan. So when you are preparing compliance plan and the delay at the same time, we'd like to see the sequence of seismic compliance scope and how it basically takes you to that extra time. So we might ask additional documentation for the extension. And again, as always, if we remark it, it's going to be in writing, and the facility will always have an opportunity to respond. We understand the some uncertainty nature of this, and we will try to resolve as quickly as we can, but definitely it will be less than 120 days turnaround time. So in terms of where all these information be going and published, it's going to be on our website. So if you are familiar with our facility detail webpage, which there's a link here, this is where you see your facility information, building list, building services, and many other things. Compliance plan will also be part of it. So when a compliance plan is submitted, then we first will take a look at it, and if we remark it, or if we approve it, or if we deny it, it's gonna appear under here. So it's not gonna appear till we review it, but it's gonna appear when we remark it, deny it, or approve it. So our comments will be visible. So we truly believe that this should be fully transparent process. So the public will see our comments and the facilities plan. So every day we are improving our visualization. So we try to make it a little more understandable by the public. So we have dashboards and milestone markings and things like that. And it will also clearly show whether the compliance plan has been finalized, approved, remarked, so things like that. So it's going to be all there. So when putting together the seismic compliance plans, you know, one common thing that will also come up is the upcoming deadlines. So we just squeeze this one in here just to remind everybody. So by the end of this year, compliance plans are due, and also the delay to 2030 AB 869s for the eligible facilities are due. 3 months later, the construction drawings are due for MPC4, 4D, and 5 retrofit. Or if your plan is to remove general acute care services from a building, the removal of acute care drawings are also due March 1st, 2026. March 1st, 2028, that's the deadline to obtain a permit for the MPC and RACS projects. And 2030 is the day to complete and get the MPC 5 and SPC 4D or 3, 4, 5 as a compliant building. If the 869 application for the eligible facilities are approved, then the final date will be beyond 2030. I want to emphasize that for facilities who are you know, eligible and approved, extension January 1st, March 1st, 2026 and 2028 still applies. The construction side is getting extended. To recap all this timeline, we have a very nice visual representation of the timeline, which we recently put it on our website. So this link will take you there. So this kind of walks you through the details of timeline. With that, we're gonna head to the milestone or the compliance plan examples. So I'll turn to Haley for that. Haley?
Thanks, Oli. All right, I will be walking us through some examples for that second part of the compliance plan that Oli mentioned. There's a compliance method, and then there's the building milestones section. So these will be examples of the building milestones. And as he mentioned, we have an Excel spreadsheet that has a list of lots of possible cases. We're hoping that we'll cover most, if not all, of the cases that you'll be running into. There's another link on this slide if you would like to download that. We have all of those examples shown in this presentation. So we'll start out with this fictional hospital site plan. This is a hospital that has 2 buildings, 2 GAC buildings on it. So the one on the left here, building number 2, has an SPC3 and an NPC3. So the SPC3 is compliant and the NPC3 is not. So this building will need an NPC4 and NPC5 retrofit if this facility wants to stay in operation with the same services after 2030. And the building on the right, building number 1, is an SPC2 and PC3. So that means that this building will require an SPC4D retrofit, NPC4 retrofit, and an NPC5 retrofit. if they want to continue to stay operational after 2030. So let's look at what those milestones might look like. So if you have a campus with more than one GAC building on it, and you have a building that needs all three of these retrofits, SPC 4D and NPC 4 and 5, then this example will apply to you. So I'm gonna walk through all of these milestones. So even if this example doesn't quite apply to you, I still recommend you pay attention to each of these milestones, because I'll explain what each of them are. And in the next steps, I won't explain quite as much. So again, this example is for a facility with more than one GAC building on campus, and one that has all three of these types of retrofits for one of their buildings. And the reason that's important is because there's only 10 slots for the milestones. So you have to be a little strategic in how you pick which milestones to include. So this is our suggestion if you have this scenario. So we'll start with building number 1, which is the one that has the SPC4D. So we're recommending for your first, you use a milestone type material testing report submittal. So this column is the one that has a drop down. So these are all pre-written options, and you can select one. So this is the one we're recommending for your first. And then the description is a text field. So you can put your own description in here, and this is our recommendation. So this will be for the MTCAP submittal. So that's the Material Testing Condition Assessment Plan. So this is your high level evaluation type of document that you send in to us saying, this is where we think we need to do material testing and condition assessment. So that's number 1. Number 2 is an evaluation report submittal, and that's for the SPC4D evaluation that comes to the Seismic Compliance Unit. So for these, you would put your dates next to it in the ESP when you're actually filling out the application. So maybe when you are figuring out which milestones to use and you download our template, maybe you add a couple of columns on the right to put in your date and whether you're going to use that as a critical milestone. And the dates that you would use, for example, for this SPC4D is the date you're planning to submit that evaluation to us. Milestone number 3 is a construction project submittal. And what this is for construction documents or your design drawings. So this is for the SPC4D upgrade construction document submittal, and that goes to the region. So again, this would be the date you're planning to submit those documents to the region. Number 4 is a construction milestone. So construction milestones are exactly what they sound like. They are for construction. And in this example, we are recommending you use the 20% completion milestone for your SPC4D. So when you go into construction to implement your SPC4D upgrades, once that construction is 20% complete, that would be meeting this milestone. And if you're going to be choosing intermediate construction milestones, we would prefer that you use a 20%. It's a good indicator that the construction is underway and has momentum. So this is what we recommend to use. There's a little space here for another. So for the second construction milestone, we're selecting the 50. So if you can fit 2 intermediates in, 20 and 50 are our preferences. And then milestone number 6 is the construction final for that same project for the SPC4D upgrade. And then milestone number 7 switches into the NPC parts of the upgrade. So this is the NPC 4 or 4D construction document submittal. And for your text here, you can select if you're going to be doing NPC 4 or 4D. You don't have to put the slash here. You can put the one that you're actually planning to do. And that is for, this is for the construction documents for the NPC 4D retrofit. And this one does have a deadline associated with it. So the NPC construction documents are due this upcoming March 1st, 2026. And then the following milestone, number 8, is the NPC 4 or 4D permit issuance. This is when you obtain a permit from the building, or a permit for the construction from the region. And this one also has a deadline associated with it. This one is due March 1st, 2028. And number 9 is another construction milestone. So this is likely a separate construction project. And this one will address the NPC 4 or 4D construction that is needed to bring the building into NPC 4 or 4D compliance. And since there's only room for one intermediate milestone, we selected the 20% completion mark there. And then the last milestone we used here is construction final, and that's for the completion of that NPC 4D construction project. So you may have noticed that this building needs an NPC 5 upgrade, but there are no NPC 5 milestones in here. And that is an important point to pay attention to, because many of you will likely run into this scenario. So we are recommending and allowing that you only put the NPC 5 milestones on one building per campus. And that will hopefully save you a lot of clicking to do all these drop downs for every single building. And then also down the line, if you have to make a change to an NPC 5 milestone, that way you don't have to go change it on every single building. So in this example, this one is very crowded. It has the SPC 4D, NPC 4, and NPC 5. So we left the NPC 5 off of this one and included it down here. So in this building, I'll run through these as well. So start with the evaluation report. That's the NPC 4 or 4D evaluation report. That's the engineering analysis that comes to the seismic compliance unit. This one is one that already had a deadline associated with it in the past. So hopefully that date that you submit will be in the past. And if it is, then in the status section where you select met or not met, then you can put met if it's in the past and you have already done it. Milestone number 2 is another evaluation report for the NPC 5, same thing, engineering analysis that comes to the seismic compliance unit. Number 3 is the NPC 4 construction documents to the region. And number 5 is the NPC 5 construction documents to the region. And then the NPC 4 permit, NPC 5 permits after that. And again, these ones have a deadline, that's the March 1st, 2028. And then the rest of the milestones will be pertaining to construction. So the construction completion, 20% completion of the NPC 4 construction project, the 20% completion of the NPC 5 project, and then the construction final for each of those. So let's look at a different example. This is for a hospital that has only one general acute care building on campus. And if that hospital is going to be going through SPC 4D, NPC 4, and NPC 5 retrofit. So this will be the most condensed set of milestones. You have to fit all of that into the 10. So here's how we're recommending you squeeze those in. Start with the evaluation for the SPC 4D. And then the construction documents, that is called the construction project submittal. That is to the region, your construction drawings. And then a construction milestone for the SPC 4D. Again, if you have room for an intermediate construction milestone, we like that 20%. And then construction final, so that's when the SPC 4D construction project would be complete. And then the NPC 4 construction documents and the NPC 5 construction documents. And following that, there's room for a permit issuance. We selected the NPC 4 or 4D permit issuance here. If you feel that it makes a lot more sense to do an NPC 5 permit issuance, then maybe you do that. If you have maybe just some end-of-line sprinkler bracing for your NPC 4, and then your NPC 5 is a very large project with lots of tanks, that might be a better indicator of your path to compliance. So maybe NPC 5 would make more sense there. You can evaluate that based on your own conditions. And then milestone number 8 is construction milestone for NPC 4, the 20%, construction milestone for the NPC 5, 20%, and construction final. And this one's a little special. This has the NPC 4 project and NPC 5 project kind of smushed into one. And in this case, you would select the last date of those. So whichever project is going to finish last, put that date on this milestone. And that's how we're recommending you fit all those projects into one if you only have one building on your campus and are doing all 3 of those retrofits. So for the rest of the presentation, we'll be sticking with this larger site plan. This is also just a fictional site plan that is meant to illustrate every case that we think you might anticipate. So each of these buildings represents a different type of compliance, different compliance method. So we'll start down here with this yellow one, diagonal yellow one, for example, number 2A. This is building number 10, and it's an SPC3, NPC3. So in this example, this building needs an NPC4 and an NPC5 retrofit. So if you have a building that needs NPC4 and 5, this example would apply to you. This again starts with the evaluation reports, one for the NPC4 or 4D and one for the NPC5. and then construction documents, one for each, the NPC 4 and the NPC 5, and then permit issuance, again, one for each. Construction milestones, 20% completion for the NPC 4 and NPC 5, and then construction final for both of those. So this example of milestones will apply likely to many buildings. And here in this blue bubble is an example of all the combinations that would be applicable for this milestone. So for example, if you have an SPC 4 NPC 2 and you're planning to retrofit the building and keep it in operation after 2030, then this set of milestones would be applicable to you, or SPC 3, NPC 3, any combination in this bubble, this set would be applicable to you. So let's move to the next example for number 2. And this building only needs an NPC 5 retrofit. And we're going to consider that kind of also in light of that one we just did, the NPC 2. Since these buildings are on the same campus, and this building only needs an NPC 5 retrofit, rather than regurgitating all the NPC 5 milestones back on this building, since they're already on the one we just looked at for example 2A, you can just use the construction final for the NPC 5 construction project. And then in the description, we can use this suggested text and reference that building number. So the one we just looked at was called building number 2. Reference that building for the intermediate milestones. And this way, you don't have to copy that onto every single building and update a bunch of dates if you have a change in the future. So you can use this if you have a campus with multiple buildings and any buildings that only need the NPC 5, as long as you list the NPC 5 retrofit milestones on one of those buildings. So again, there's an example of the types of ratings you might have if this example were to apply to you. So an SPC 3 compliant rating and an NPC 4 or 4D. The next example, number 3, is a building that only needs an SPC 4D retrofit. So maybe a little bit more rare, but if you have a building that is an SPC 2 or an NPC 5, then this example would be applicable to you. And unlike the other ones where there was a bunch of different combinations of ratings, this one really only has one combo, and that's the SPC 2 and NPC 5. So here's the milestones that we recommend for that. And this one has a little more in-depth of the SPC 4D since there's more space to spread out. So a material testing program submittal. So that's the material testing report submittal milestone type, and the description is MTCAP. And then an evaluation report for the SPC 4D. Another material testing report submittal, and that is the MTCAR. So this is the material testing condition assessment report. The program is what you send in, is the high level of this. These are all the things that we're planning to test and assess. And then the MTCAR is what you send in after the drawings are done, all the testing is done, and the results are in. This is the results of all that testing. So this would be the date that you plan to submit that to the Seismic Compliance Unit. Milestone number 4 is a construction project milestone. Those are the construction documents. So that's the SPC 4D construction project submittal to the region, and then the permit for that project. And then there's room for 2 intermediate milestones. So we have the 20%, 50%, and the final. And then if you have remaining spaces, you can choose NA in the milestone type for the remaining 2. This next example is if you have a building on your campus that is already 2030 compliant. So this is an SPC 4 NPC 5 building. There's a couple other ratings that this could be applicable to. If you have an SPC 3 and an NPC 5, or any of these SPC 3 ratings and an NPC 5, then that building is already compliant. So for this, you only need to select 2030 compliant and write already compliant. So the next example is number 5 for a building that is planning to be demolished. So in the site plan, we have an SPC2, NPC2. That rating is not particularly relevant to this case. What is relevant is that the facility is planning to demolish this general acute care building. So if you have a building that you're planning to demo in order to bring it into compliance, then this is the example for you. So these milestones are a little bit different than the ones we've seen before. I'll walk you through them. The evaluation report submittal milestone is actually a letter. So this is a letter that you send to the Seismic Compliance Unit that has your intent to remove general acute care services. You include the date that you're planning to remove and that you're intending to demolish this building. So that also has already, the due date for that has already passed. So your date for that may be in the past and already met. And if it's not, then please get that into us as quickly as you can. The next deadline is the construction project submittal. So demolition requires construction. So you'll need to send in a demo construction project to the region. And then you'll need to pull a permit for that. These also have deadlines associated with them. The March 1st, 2028 for obtaining a permit. And then construction milestone for disconnecting the utilities so that the building is no longer usable. This is a special milestone for if you are demoing a building. So we'd like to know what date you're anticipating the utilities will be severed so the building is no longer usable. So please include that if you're going to be using, if you're going to be demoing a building. And then these other three are more familiar, the 20% completion of the construction project, 50% completion of the construction project, and the final for when the demolition is complete. Example number 6 is a building that already has no general acute care services in it. So if you have a building with administration possibly or some kind of outpatient, it's a building where you would not have to move any general acute care services and you just want to convert it to an OSHPD 1R, then this example will apply to you. If that building is adjacent to other buildings, then there are considerations that you need to make as far as utilities and egress, and whether other OSHPD 1 buildings or buildings with general acute care services rely on that building for the utilities. So that if the utilities pass through it, if the egress passes through it, then you'll have to relocate that egress and fire alarm. So for this example, these buildings are all adjacent, and this building is going to stay a general acute care building. So if there are utilities that run maybe through this building, or if there's a main entrance over here and the patients have to walk through here, then those utilities, that egress will need to be rerouted before it can become an OSHPD 1R building. So let's look at the milestones for that. So this one starts with the evaluation report milestone type with that intent to remove general acute care services letter. So a letter telling us by what date you're planning to remove the general acute care services. And then a construction project, because in most cases you will have construction for this to move those utilities or some kind of egress. And so the construction project submittal, those construction documents are due to the region March 1st, 2026. So those deadlines that apply for the NPC 4 and 5, those dates are the same for an OSHPD 1R or removing general acute care services. You also may be transferring this to a local jurisdiction rather than converting it to an OSHPD 1R. The point of this is that you are that you don't have any general acute care services and it's no longer going to be an OSHPD 1. So either it will go to an OSHPD 1R status or it will be transferred to the local jurisdiction. Either way, probably there will be construction. So the March 1st deadline is for the construction documents. March 1st, 2026 deadline is for construction documents. March 1st, 2028 is for the construction permit. And then our familiar 3 construction milestones here, the 20% completion, 50% completion, and construction final. Example number 7 is for relocating general acute care services. So let's say you have a building that has some general acute care services and you are going to be moving it to a new building, one that is already under construction or proposed. So in this example, this dashed dot line here is a building that is under construction, and these existing services will be relocated to the new building. So this also will likely have construction for the same reasons as the previous example. If you have egress or utilities, fire alarm, anything that another GAC building requires and is passing through that building you're planning to remove GAC services from, those will need to be moved prior to removing the achieving OSHPD 1R or transferring to a local jurisdiction. And this also may have some additional construction, because when you move services, there's inevitably going to be some kind of demo or construction to move the equipment, move the services, or maybe make ready for the next service or whatever is going to come behind. So let's look at these milestones. This table is actually identical to the one that we just looked at, and the work is also very similar. So it starts with your intent to remove a GAC services letter that you send to the Seismic Compliance Unit, and then your regional project submittal for that construction to move utilities, egress, or the services themselves, and then a construction permit and the construction milestones. And those, the March 1st, 2026 and 2028 deadlines apply to these as well. So the drawings are due March 1st, 2026. Permit is needs to be obtained by March 1st, 2028. And again, this bubble kind of reiterates the ultimate goal of this milestone is either 1R or transferring to the locals. And example number 8, very similar, except instead of moving the services to a new building, we'll be moving services to an existing building, an already compliant building or a building that has a path to compliance. So in this example, this is an SPC 5, NPC 4, but the rating is not particularly relevant, so don't get hung up on that. The thing that's relevant for this is if you have a building with GAC services that you are no longer going to be using as a GAC services OSHPD 1 building after 2030, and you want to move those services to an existing building, then this is the set of milestones that we recommend you use. So these are again very similar. Actually, the milestones are identical to example 7 and 8, and the work required is very similar. So send in your letter. We're planning to remove general acute care services from this building, and on what date those services will be removed. And your construction project submittal, that's your drawings. Your construction permit, again, those deadlines we previously discussed apply to this as well. And then your 20% construction milestone and your 50% construction milestone and your final construction milestone for getting those services removed and that building either converted to an OSHPD 1R rating or transferred to the local for their jurisdiction. All right, and with that, I will hand it back to Kelly.
Thank you, Haley. So this is going to bring us to the end of our presentation today. We hope you found this webinar to be helpful. Please remember, if you didn't download the PDF handout, you may do so now by going to the handout section of the Go-To panel. Alternatively, the slide handout will be available on the HCAI website in approximately 1 week. Also, today's session has been recorded and will be available on the HCAI website in approximately 2 weeks' time. If you have any questions about today's presentation, please email us at seismiccomplianceunit@hcai.ca.gov. It's been a pleasure being with all of you today, and thank you for doing your part in providing access to safe, quality healthcare environments throughout the state of California. Have a nice day.